Yesterday, I interviewed Dr. Paul Tupper from Simon Fraser University about an August 13th study that his COVID modeling group released and showed to Alberta Health Services. Now, it got a little media at the time, but what we know now, a month later, is that it accurately predicted the September surge in COVID-19 infections that has overwhelmed Alberta hospitals. In fact, the study said that that would happen. And basically, Alberta Health had it and didn't act on it. It knew what was coming and didn't take action. I'm going to talk to Dr. Joe Vipond, an ER doc in Calgary about that. So welcome to the interview, Joe.
Thanks for having me on.
Okay, so in light of what we know now, Dr. Dina Hinshaw has apologized for mistakes that her department has made. The Premier has apologized for mistakes the Alberta government has made, all well and good, but they seem even more egregious now that we know, or that we think that they know, or they knew a month ago that this was going to happen. They didn't act. What's your take?
Yeah, I mean, that's the scary thing is this information was in their hands and there was no real solid movement until yesterday or 2 days ago, and even arguably not enough then. So what do you say about leaders who ignore the truth that your healthcare system is about to collapse? It's very frightening.
So you work in that healthcare system. You're an emergency room doctor. What are you seeing on the ground?
Well, I never like to speak about my specific situation because really the problem is Alberta-wide. And what we're seeing is that we're at 220 ICU cases per day. We have a doubling time of those ICU cases of 15 days right now. And so if that's projecting going forward, we could have, by the end of the month, about 400 ICU cases. And we can't take care of the 220 cases we have at the moment. So I'm not sure. I'm not sure how to get out of this. They've talked about sending patients to other provinces. You can't send hundreds of patients to Ontario. BC and Saskatchewan aren't options because they're overrun equally. So we're looking at triage, and that's what really frightens me.
Well, so what do we say to a government that admits that it made huge mistakes like this? Because I think it's fair speculation to wonder if, in fact, the decision had anything to do with the fact that a federal election was called several days after, and Conservative Party leader Erin O'Toole pointed to the Kenney government's handling of the pandemic as an example to be followed by the rest of Canada. What do you make of that?
Yeah, it's hard for me to tell why they would do this. I think there's a couple of things. One of the fears that I've had is this idea called the Great Barrington Declaration, where a right-wing think tank suggested the best way of dealing with COVID was to let it run rampant through society, especially amongst the least vulnerable, which is our kids. And then we'll achieve herd immunity, and it'll be like ripping off a Band-Aid quick instead of pulling it off slowly. And I think it's pretty evident that they've focused on kids. Even now, our kids have almost no protection in schools. There are exemptions to the mask mandates in the policy. K-3 aren't protected. These are kids that aren't vaccinated. We know that's the highest cohort of infections right now, and they're still not protecting them in schools. So I really worry that ideology got a hold of them, and they weren't able to see the actual danger behind this plan. But it was easily forecastable.
On social media, I see parents in Alberta panicking about having their kids in the school system. Dr. Tupper told me yesterday that children with the Delta variant being, dominant now, that children will be infected at the same rate as adults. Do you expect to see that in Calgary?
No, we're seeing it. They're the highest cohort. 5 to 11 right now is the highest cohort of infections per 100,000. And this is completely predictable. It was arguably intentional. So and we had 2 kids enter the ICU yesterday, one in the NICU, but one in the 11 to 19 range. And we're seeing kids get sick, and this is what happens. Even if it's a very, very low rate, when you get a high enough denominator, you're going to have real illness.
Joe, there's been some debate, again, on social media about, is the Alberta health system, like the acute care, the hospital system, is it on the verge of collapse? Is it collapsing? As a healthcare professional, what's your take on that?
Well, if you've already canceled all your elective surgeries and you're thinking about doing triage, I would argue that's collapse. My biggest concern is the long-term impacts of this. You have a healthcare workforce that has been denigrated by the government. They've threatened to cut their wages. They've threatened to be privatized the system. And now they're giving inadequate PPE protection. We're still being recommended to use surgical masks and not N95 when we interact with COVID patients. This is criminal. So healthcare workers are just going to basically throw up their hand and say, I'm done. And then when this wave is over, we're going to have a weakened healthcare workforce, and you can't run a system without nurses and doctors and respiratory therapists and administrators. So I didn't even mention the moral injury of having to deal with death and illness that was completely preventable. So all of these factors combined mean we have a short-term problem and we have a long-term problem.
Now, we're seeing Alberta Health Services announce, closure of emergency rooms on a temporary basis. They, be 24 hours. They can't get doctors, and it seems like we're seeing nurses and doctors, nurses quit the profession. We're seeing them move out of the province. What kind of an effect is that going to have on Alberta's ability to manage this, burgeoning crisis?
Yeah, it's going to be the Alberta disadvantage. We've already heard of, companies that have decided not to move their satellite offices or their head offices here. We've heard about companies conferences canceling their plans because of this government. It's ripples far beyond the healthcare system, unfortunately.
Now, you've led protests in Calgary about around this issue. Are we going to see more protests, more demands for maybe stricter pandemic management measures?
Yeah, it's too dangerous right now. Delta's a beast. It can transmit outdoors. I'm not comfortable with the 200-person limit that the government has put for outdoor gatherings. It's a beast. We've seen multiple instances of outdoor transmission, especially at large gatherings. We've moved our advocacy online. We have formed a group called Protect Our Province Alberta. We're doing regular briefings. Our next one's today at 4 p.m. talking about the impact on the healthcare system. And we have ones next week on schools again on Tuesday, and on better masking on Thursday. And we're rebutting the government's talking points. The big things this government's getting wrong is COVID is airborne. We need to treat it as such and put in good mitigation. COVID is being transmitted majority-wise through asymptomatic transmission, and we need to put policies in that reflect that. And finally, schools are important nidus of infection, and we need to, if we don't manage schools, we fail. That's hands down. And that's the main reason why I think the plan announced 2 days ago is going to fail.
So you're arguing that not only was the Alberta government late to the game in terms of managing this, but their strategies are fundamentally wrong and not based in science.
Yeah, like the airborne discussion is kind of interesting. It'd be like saying, if we stop people from deep French kissing, we will beat the chlamydia crisis. Well, guess what? Since chlamydia isn't transmitted through deep kissing, you can say that all you want, it's not going to work. You need to get the transmission route right, or you fail, and we're failing.
Well, let's just follow up on that a little bit, because I've interviewed you before about that. So the essential argument, as I understand it, Joe, is that you're saying that the primary means of infection is aerosol transmission, as opposed to touch and droplets, which is kind of the orthodoxy at Alberta Health. Have I got that right?
Right. And I just like to point out, it's also amongst other provinces, including British Columbia and Ontario. This is the history will not look kindly on our infection protection and control people who have made this decision. We have dozens of outbreaks in Alberta right now, hospitals. We have decreasing attendance rates at emergency rooms because patients are rightly concerned that they may end up being infected in the hospitals. the patients and the healthcare workers deserve the best protection possible from an airborne transmitted disease. And I'm calling right now for strong recommendations, maybe even mandates for N95 use in hospitals by healthcare workers, especially in places like emergency rooms where we see so many undifferentiated patients.
Well, that seems like a very reasonable request, Joe. Thank you very much for this. Always appreciate your insights.
Thanks for having me on.